I'm Cheyenne. I'm going to be your student nurse today. I'm going to be doing a head to toe assessment. Is that okay?
Mm-hmm.
I'm going to be doing my hand hygiene. I'm going to close the curtain. Can you please tell me your name and date of birth?
Chelsea Summerlin, 2/24/2000.
Perfect, thank you. I'm going to work the bed, move the bed up to a working height. Can you tell me where you are?
OU,
OU, and can you tell me why you're here?
for my head to toe assessment.
Okay, and do you know what time it is?
It's about 11:30.
Perfect, thank you so much. Okay, so as she was answering those questions, I noticed that her hygiene and grooming was appropriate, her clothes are not mismatched, and it's appropriate for the weather. She's alert and oriented ×4. She's on room air, and her breathing is non-labored. So now I'm going to go ahead and check your skull for any unusual lumps or masses, your neck, and check your ears. Ears are symmetrical, facial features are symmetrical. I notice no draining or redness in her ears or nose. Her eyes, her sclera and conjunctiva are china white. I notice that she has no mucus or anything, drainage coming out of her nose. I notice her lips are white, color is appropriate for ethnicity, no cyanosis noted. Now I'm gonna go ahead and check her carotid pulse. Alright, carotid pulse is equal 2+, equal bilaterally, regular rate and rhythm. Now I'm gonna go ahead and have you lean back to 30 degrees. I'm gonna check your neck. Alright, thank you. No JVD is noted. Now I'm gonna go ahead and check your moisture on your upper and lower extremities. Alright, skin is warm and dry. It's pink, appropriate for ethnicity. And I'm gonna go ahead and check your skin tuger. A quick little pinch. Elastic skin turgor, no tenting noted. I'm gonna go ahead and check your cap refill. Cap refill, less than 2 seconds on upper extremities. I'm gonna check your cap refill on your toes. All right, cap refill, less than 2 seconds on your upper and lower extremities. While I'm down here, I'm gonna go ahead and check your edema on your tibia and your ankles. So I'm gonna press down for 5 seconds. Alrighty, and then I'm gonna do ankles. Alright, no edema noted. Skin is smooth. Alright. So now I'm gonna go ahead and do your muscle strength. So can you grab my hands please and squeeze? Thank you. And then have you push up on my hands and then push down. Thank you. Muscle strength is 5+ on the upper extremities. I'm gonna have you push down on your feet. Thank you. And then push up. All right, muscle strength is 5+ on upper and the lower extremities. Now I'm gonna go ahead and listen to your heart. You can just relax for this. You can use my diaphragm. The aortic, second intercostal left sternal space. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. The mitral, fifth intercostal space, mid-clavicular line. And while I'm here, I'm going to check her apical pulse for 1 minute. typical pulse is 80 beats per minute. I noticed the S1 is most prominent in the apex and S2 is most prominent in the base. Now I'm gonna go ahead and check all of your pulses really quick. We have the brachial, 2+ equal bilaterally. And the radial pulse, 2+ equal bilaterally, regular rate and rhythm. I'm going to check your posterior tibialis. 2+ equal bilaterally, regular rate and rhythm. And the duralis pedis. Alright, 2+ equal bilaterally, regular rate and rhythm. Alright, now I'm going to go ahead and check the symmetry of your lungs. So if I can go ahead and have you take a deep breath for me. Thank you. I'm gonna go on the posterior side. Deep breath for me. Alrighty. Lungs are symmetrical anteriorly and posteriorly. No masses noted. I'm gonna go ahead and listen to your lungs now. And you can just breathe normally, okay? No adventitious lung sounds noted. Anterior side. Now we're going to check the posterior. No adventitious lung sounds anteriorly or posteriorly. All right, now I'm gonna go ahead and check her respiratory rate. I'm not gonna let her know I'm checking her respiratory rate. I'm gonna be checking her pulse, just so it doesn't affect the rate. I'm gonna do this for a full minute. Respiratory rate is 16. I'm gonna go ahead and have you lay down for me. Alright, I'm gonna check your abdomen now. I noticed that her contour is flat. Now I'm gonna go ahead and listen to your bowel movements. I'm gonna start in the right lower quadrant. bowel sounds are normal, active. I'm gonna go ahead and palpate your abdomen. If you have any pain or discomfort, let me know, okay? I did not notice any abnormal masses or lumps. The patient did not indicate any pain or discomfort. Go ahead and sit you up. Alright, I noticed that the patient doesn't have any tubes or lines or pegs or anything like that. Do you have any questions for me? No? Alright, I'm gonna go ahead and lower the bed back down. I'm gonna raise the guardrails up. I'm gonna lock the bed in place. Make sure she has her non-skid footwear. Put her call light next to her and say thank you so much for letting me do this. And then do my hand washing, and that is it.